I request Dr. Meena CK to present her talk on advances in amblyopia management. Amblyopia has come a long way. Dr. Meena is a very renowned pediatric ophthalmologist, strabismus surgeon, and a phaco surgeon. Over to you, Dr. Meena.
Thank you, madam. I'll be speaking on advances in amblyopia management. There has been so many overlaps. Even yesterday we had so many talks on this, and I have no financial disclosures here. And as all of us know, amblyopia definition, like the physician sees nothing wrong for the reduced vision, and also the patient doesn't see well. And the current treatment options we have are patching and penalization. Of this, mainly we depend on patching. And as all of us know, patching is a very good form of therapy, and it does give improvements. But only thing doing it is usually they don't stick to the treatment protocols and regimes. So why do we need a change from patching? So there has been a paradigm shift in how the etiology of amblyopia is being viewed. Like we always, whenever we do patching, we are just closing one eye. So this is like, it has been now considered to be a binocular problem. So structurally you have an intact binocular system which is rendered functionally monocular due to the suppression, and also whenever you are doing the patching, you are covering the good eye is not at all working. So now all the treatment regimes, most of the treatment regimes are based on using both the eyes. So what are the replacement for patching and penalization? So you should know two terms mainly, that is the perceptual learning and the dichoptic therapy. So perceptual learning has a very complicated definition, but basically what you should know is practice makes perfect. So you do the same thing repeatedly to make it perfect. So you have monocular as well as binocular perceptual learning, but more importance have been given in the reason for the newer treatments for binocular perceptual learning, where you involve or use both the eyes. And here comes the dichoptic therapy, where both eyes are being used and each eye is exposed to similar but slightly altered stimuli, and they are presented simultaneously. It is just like what we were using in the synaptophore earlier, which we are not using much today, but this is being used with the help of devices. So how do you do it? Like there are different methods of how to differentiate the two images. Like you can change the contrast. Like one good eye you give low contrast, and the amblyopic eye you give higher contrast, or a visual blur, like the image is blurred in the better eye. And also partial presentation, like you had a rabbit and a tail in synaptophore, you give incomplete images in two eyes and you have to fuse it, only then you will see it as a proper image. So how do you give all these, like it has to be more interesting, especially because children are involved. So how do you provide all these images? Like you have these interactive video games, then virtual reality and augmented reality devices are the, has been given so much importance nowadays, and you can even have passive dichoptic movie, that is just sit and watch a movie, but you have to use both the eyes to get a proper view of the movie. And so much has been talked about vision therapy, because nowadays it seems like it's not, your aim is not to improve the number of lines of vision, but it also to improve your binocularity, your stereopsis, etc., and transcranial electric stimulation, of which we have no experience. So we'll go into a few of which that is available in the market, and I have no financial disclosure. We do use one, and here you can see that this is the vision therapy, where you can see dissimilar images in both the eyes. Like you can change the contrast of the image, you can change the brightness, or you can dim it. So there are usually the weaker eye is given a better image, and the basic principle is you have to use the weaker eye to get a product. Like if you have a game or something has to happen in that device, you have to use the weaker eye. So here you can see that you can change the contrast, the colors, everything in the video. Now this is the virtual reality or the augmented reality ones, luminopia, which is FDA approved, and here again you can see that the child has to use the goggles, the virtual reality goggles, and you can see the reduced contrast in the better eye, and you have a dichoptic masking. That is, you have to see the proper image, you have to use both the eyes. And even they can watch movies or videos with the help of these virtual reality goggles. So it helps to keep their interest, and it is FDA approved also. And this is something like passive, as I mentioned earlier, you have passive dichoptic movie viewing. That is, the image, the importance of this thing is you have a pupil tracker. So most of these cases you have to use red blue or red green goggles, and here you can see that there is, because of the pupil tracker, the center of the good eye is blocked. Like you have a blurring of the central view, but your peripheral vision is still there in the good eye. So your good eye is still working, it's not that's completely blurred. And this blue light in front of the weaker eye is helping to get a proper image, and also so you are using more of your amblyopic eye. Now this is what we have experience with Binox. Like Binox vision therapy, again here the background is same, but the foreground is little different. That is, here again you are using the red and blue goggles, and the blue, the weaker eye only is has to act to bring about some action, like this blue car chasing the petrol bunks. So it has to be used. So that is the basic to keep the interest of the child. So most of these are games. And Revital Vision is yet another FDA approved one, and here they say it improves even adult amblyopia, and GABA patches are being used here. That is contrast, they can be changed, like the contrast as well as the, you can see the patches here, the GABA patches. And orthoptics, which has been invented by our own ophthalmologist, where it's something like a field test, where you have to spot the peripheral lights, you have to count the peripheral lights with each eye, and also binocularly, which has been developed by Dr. Santam Kobal, an ophthalmologist. So the major problems are the cost of these devices, and also you have to, the home therapy might be easy, but I don't know if they do it properly. So some amount of office therapy you have to start with, and in severe amblyopia we have seen that it's not that easy. Though you have medical therapy, we are not using it much, and the main problem with this perceptual learning is the boredom and the time factor, but still it is excellent. When compared to patching, I think more interest for the children will come for these type of treatment, and hope we will come up with more devices soon. Thank you.
Thank you, madam. Thank you, Meena madam, for the excellent talk.